Morning. This is Thomas Bartell, board certified plastic surgeon and specializing in body recontouring surgery. It's nice to be back. Sorry we missed last week, but my daughter was having surgery. It was very successful. I'm pleased to report she's home convalescing with her arm in a sling and a plate, a new plate, so she's now bionic. Today, what I'd like to do is talk a little bit about realistic expectations in cosmetic surgery. This is a very important topic for a cosmetic surgeon and patient relationship to be successful. What is the measure of success in cosmetic surgery? The measure of success is when both the surgeon and the patient are happy with the outcome. Now, there's many times when one or the other might not be happy, but if both of them are happy, then that's a successful outcome. Now, you can have the best cosmetic outcome in the world that 99 out of 100 people, plastic surgeons, patients would say, that's a great outcome. But if that one person who doesn't think it's a great outcome is that particular patient, that outcome is a failure. So, this is a kind of a dance between the two parties. It has to be a symbiotic relationship. They have to agree on what is a successful outcome. And most of this discussion really needs to take place before the surgery. A lot of this, the problem with this has to do with the image of perfection that we have in society today. And because of the explosion on the internet, and print material, the magazines you see at the checkout counter of these beautiful people, they are. These are beautiful people. They're models. This is what they make their living for. But this is not the average person. And if you look at these people and say, I want to look like that, boy, I tell you, that's a tall order for any surgeon. Bodies are not like cars. You can't take a part off of this one and put a new one on there and expect it to look like a Ferrari. It's just not the way it works. Now, there are no guarantees in surgery. Surgery is not, this is an art more than a science. It really is. You can have the most skilled and experienced surgeon in the world, but it's skill and experience versus the anatomy and lifestyle of the patient. You can't change things completely around if from where you're starting from is not an ideal situation. The patient who is overweight, the patient who continues to smoke, you're just not going to get a particularly good outcome in those patients. So preoperatively, there has to be an honest discussion between the surgeon and the patient, and honesty has to be on both sides. The surgeon needs to be very honest about what he or she can accomplish in your particular case, and you as the patient need to be very honest with what you need to expect from this surgery. If one of those two things is out of sync, this is not a good idea. So, honesty preoperatively is the most important thing. And part of that is the possibility of complications. Complications are inevitable in surgery. We'd love to eliminate them completely. The most talented, the most skillful surgeons still have complications. There's a saying in surgery, you show me the surgeon who has no complications, I'll show you a surgeon who doesn't operate. That's just the way it is in this world. We'd love to minimize the complications, and we do. We do everything we possibly can to minimize complications, but they still occur. And it's important for patients to realize that, especially because with cosmetic surgery, your insurance company is probably not going to pay if there is a complication that results in more surgery necessary or a hospitalization, God forbid. You just got to be, prepared for that. In the unlikely, very unlikely, but potential possibility that could occur. Now that brings us to the topic of safety in cosmetic surgery. We always, of course, surgeons reliable surgeons do everything possible to improve safety at every turn. We are board certified. We operate in a accredited facility. We have a good staff. We do everything as safely as we possibly can. But the patient should also be aware that safety is a responsibility on their side as well. The patient who comes in, who wants the traditional mommy makeover, they want to have their breasts lifted and implants put in and a tummy tuck and liposuction and all that kind of stuff. Can that be done? Well, theoretically it could, especially because they've seen it on, extreme makeover television shows on television. But is it safe to do all that at the same time? No, it's not. And someone like me who operates in an outpatient facility, it would be outrageous to do that much surgery at the same time. It's a common knowledge among plastic surgeons that the maximum amount of time a patient should be under anesthesia in an outpatient facility is about 4 hours. After that, the complication curve starts to do this. Now, can you do more surgery at one time? Sure. But you probably ought to be in a hospital where you're going to be admitted overnight or even to the intensive care unit, monitored for a day or two to make sure that everything goes smoothly. Otherwise, it's not safe, and I won't do that mommy makeover thing. Similarly, a patient who comes in who is way overweight, their body mass index, which is calculated from a combination of an equation between your height and your weight. If it's over 32, and you can go online and calculate your own body mass index, there are these websites that will do that for you. If it's over 32, we probably aren't going to do the surgery here. Could it be done? Sure. Again, in a hospital setting, but an outpatient facility, it's just not safe. Now, I always tell my patients, I operate in the safest possible manner. If I wouldn't do it on my wife, my sister, or my daughter, I'm not going to do it on you. And that's the way it works. That way, we both stay out of trouble. Now, that brings us to the final thing I want to talk about today, which is body dysmorphic disorder. Some of you might have heard of this. It is a psychological problem similar to obsessive compulsive disorder, where a person looks in the mirror and sees something that no one else sees, an imperfection that no one else can see, but they see it, and they see it every time they look in the mirror. This is actually a more common than a lot of people think. It's about 2% of the population. It usually starts in puberty and only gets worse. It's equally distributed between men and women. Of course, there are variations of how severe it can be. The most typical and severe, one of the more severe cases is this one. And I'm sure you all know all about this, Mr. Jackson. What he perceived when he looked at his nose and he couldn't get enough plastic surgeon to fix it the way he wanted it. I mean, that's just crazy, And the worst thing that you can do is operate on these people. Absolutely the worst thing. The way you treat it is with psychotherapy and occasional antidepressant medicines, but it's not surgery, because they will never be happy. And if a patient comes in and I can't see the problem, I can't fix the problem. So, if people are telling you, when you tell them you want to have something done, some cosmetic surgery done, and they're looking at you, your friends, and say, you don't need to have that. You look perfect the way you are. If you come to my office, I'm going to tell you the same thing, and the last thing I'm going to do is operate on you. So you got to be reasonable. Reasonable expectations result in positive outcomes. So that's what I got for you today. I hope all of you enjoying this wonderful weather we're having finally, and hopefully we'll see you again next week. Take care.